From VOA Learning English, this is the Health Report. Clinical depression is a serious medical condition. The word clinical is added to identify people who are depressed from those who simply feel sad because of life events. People with clinical depression can experience extreme sadness, hopelessness, and a sense of worthlessness. Often, they are unable to carry out the usual activities of life. Sometimes they commit suicide. Clinical depression can be a difficult disorder for medical professionals to identify and treat. A treatment may work for some patients with depression and not others. Helen Mayberg is a researcher at Emory University in Atlanta, Georgia. She says the first treatment for depression often fails. So, doctors must try different methods of treatments until they find one that is effective. But technology may change that. Ms. Mayberg leads a team of researchers at Emory University. They used brain imaging technology called PET, or positron emission tomography, to study treatment effects. The study involved 63 depressed patients. They received either medication or talk therapy. The researchers found that one area of the brain, called the anterior insula, seemed to predict which treatment would work. Patients with a slow-working anterior insula did best with talk therapy. Patients with a very busy anterior insula reacted well to the antidepressant drug Lexapro. Ms. Mayberg says the anterior insula may be a biological marker for depression. She says her team's findings could help doctors treat mental disorders like other medical conditions. For VOA Learning English, I'm Laurel Bowman.
From VOA Learning English, this is the Health Report. Health officials in Brazil have declared a state of emergency in several states. They are also warning women not to get pregnant. Last year, about 2,400 babies in Brazil were born with extremely small heads. The babies have a condition called microcephaly. Microcephaly causes severe brain damage. At least 29 of these babies have died. In 2015, the number of microcephaly cases in Brazil was about 15 times higher than the year before. The U.S. Centers for Disease Control, or CDC, says there are many causes of microcephaly. The World Health Organization says it does not know the cause of the microcephaly outbreak in Brazil. However, the CDC says the link between a virus infection and microcephaly is being investigated. The virus is called Zika. Zika is spread by mosquitoes. Some babies in Brazil born with microcephaly had the Zika virus, while others did not. The CDC says that Brazil reported its first case of the Zika virus in May 2015. Since then, it has spread. In addition to Brazil, it has caused infections in other countries in Latin America, Africa, and Southeast Asia. The CDC says the common symptoms of Zika are fever, rash, headache, joint pain, and red eyes. Zika causes mostly mild symptoms in adults. However, in fetuses, the disease can cause severe brain damage. There is no vaccine or medicine to prevent or treat Zika. Health officials around the world are closely watching the situation. For VOA Learning English, I'm Carolyn Presutti.
From VOA Learning English, this is the Health Report. Cambodia has one of the highest maternal mortality rates in Southeast Asia. The number of Cambodian women dying during pregnancy or childbirth has dropped in recent years. Yet more than 1,000 young mothers and pregnant women still die each year. That number is down almost 50% from the rate 15 years ago. However, it still is short of the United Nations Millennium Development Goals. The UN Children's Fund says many Cambodian mothers die during childbirth because they lack medical care, often during emergencies. In a report, the agency said that even when mothers can access health care, overall quality of care is deficient. Kay Savannah-Roth is head of the Cambodian National Assembly's Committee on Health and Women's Affairs. She says the government needs to do more to help women. Cambodia has increased the number of skilled medical workers assisting in childbirth. Tung Rothtavi is with the Ministry of Health. She notes that the country also has doubled the number of health centers over the past 10 years. She says Cambodian officials have announced plans to expand health care in the future. She says the country needs skilled health care workers. She says the government has been working to increase resources, especially skilled birth attendants or midwives. Kay Savannah-Roth says she has received reports that women died from childbirth because their doctors failed to help. She says Cambodians do not hear about the government punishing doctors who have done wrong. For VOA Learning English, I'm Alex Villarreal. From VOA Learning English, this is the Health Report. As astronauts circle Earth, lights from our cities make our planet shine. But these lights create a kind of orange cloud or haze that keeps us from seeing the stars. Jim Doherty is president of the International Dark Sky Association. He says the orange haze is light pollution. He also says too much light is bad for your health. Studies find that too much light damages our sleep, affects hormones, and is linked to some cancers. Jim Doherty says light pollution is also bad for the planet because it is causing global warming. Mr. Doherty went to the Capitol Hill neighborhood of Washington with VOA. He says street lights there are producing too much light. He understands that Washington city officials want to make the sidewalks safe by providing good lighting. But he says there are too many lights and they are not designed well. They send light into the sky where it is not needed. Mr. Doherty says that soon streetlights will not be necessary. He says better lighting for sidewalks can provide safety without wasting energy or causing light pollution. Some communities are using new technologies that dim or lower lights at an exact time, like 1 a.m., when they are not really needed. Another possibility is using motion sensors. They turn lights on or off by sensing motion. Motion sensors can reduce lighting by 90% and still be effective. Mr. Doherty hopes more communities use energy-saving devices like this. He says he hopes that in the future, we humans can take back the night sky. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Health Report. On their own, many chemicals are harmless to human health. But in combination with other chemicals, they may become deadly. That was the finding of a 2-year study by a group of scientists. They were asked to investigate the cancer-causing possibility of chemical mixtures. Linda Gulliver was one of 174 scientists on the task force. They were told to study the cancer-causing potential of 85 chemicals. All 85 are considered to be common in the environment. Linda Gulliver is also on the medical faculty of Otago University in Dunedin, New Zealand. She says chemicals have the ability to form dangerous mixtures. Even simple minerals can become dangerous when mixed with chemicals from plastic or beauty products. While the chemicals are safe on their own, she says, the researchers found that many chemical mixtures cause cancer in human cells. Working in groups, the scientists explored how different chemical mixtures could lead to cancer. Ms. Gulliver's team looked at the ability of different combinations to support the increase of malignant human cells. She says the current way to identify whether chemicals cause cancer is to test them one at a time. This method leads, she adds, to a long list of supposedly safe chemicals. She and her team say that approach to testing needs to change. An estimated 1 in 5 cancers has been linked to chemical exposure. It may be that a cancer-causing substance is not a single chemical at all. It could be a deadly combination. The task force published its findings in the journal Carcinogenesis. For VOA Learning English, I'm Jonathan Evans.
From VOA Learning English, this is the Health Report. Children love to play. But for some children, the idea of simple, joyful playtime can seem very far away. These boys and girls may look differently than others, and they may not be able to move around as others do. A rehabilitation center near Uganda's capital is working to change that. They are bringing together doctors, volunteers, and donations from around the world. It is the first and only center for treating disabled children in Uganda. The center is called Comprehensive Rehabilitation Services for Uganda, also known as CORSU. The people there are concerned about the abilities of boys and girls, not their disabilities. On thick grass outside the main hospital, a mix of current and former patients do something others may take for granted. They are playing. They compete in sports, play games, and even perform dances. The theme of the day is simply, let them play. This is a rare event for children who are missing arms or legs, have physical deformities, or suffer from trauma. The purpose of the event is to raise money for a new playground and sports field. Campaign organizers want to make the old playground into an area that is friendly for disabled children. CORSU treats patients from all over Uganda and nearby countries, including South Sudan and the Democratic Republic of Congo. On the grounds of CORSU, there are areas where doctors can operate on patients. There also are therapy rooms, housing, and even a primary school. CORSU receives no financial support from the Ugandan government. It depends on donations. For VOA Learning English, I'm Carolyn Presutti.
From VOA Learning English, this is the Health Report. The World Health Organization says there has been an increase in the number of children in developing countries who weigh too much. In African countries, the WHO says the number of overweight or obese children is 2 times as high as it was 20 years ago. Around the world, about 43 million children under the age of 5 were overweight in 2011. Doctors use height, weight, and age to measure whether a person is underweight, normal, overweight, or obese. Overweight and obese children are more likely to become overweight and obese adults. They are also at risk of developing health problems like diabetes and heart disease. Francesco Branca is the director of the WHO Department of Nutrition for Health and Development. He says governments should consider providing vitamins for children, and they should have policies on how food is marketed to children. But reducing the number of overweight children will not be easy. The goal is difficult to meet, even in wealthy countries. Experts say lowering obesity rates is especially complex in countries that also have high rates of infectious diseases. But the WHO has some basic solutions. The organization says people should eat less fat, sugar, salt, and processed food. This can be replaced with more fruits and vegetables and increased physical activity. These goals are especially important for children. The WHO also says mothers should breastfeed their babies for at least the first 6 months if possible. The current goal for the WHO's World Health Assembly is to prevent any increase in the percentage of overweight children in the next 12 years. For VOA Learning English, I'm Alex Villarreal.